It's wonderful to be here amongst you all again. Slightly cooler than those of you that were here last year. It was a little bit on the hot side, so hopefully a little bit more comfortable to be in this fantastic venue. So I think I may have mentioned last year, but a year on for me, I'm very clear. When people ask me what I do, I keep telling them I have the best job in the National Health Service. And the reason I have the best job in the NHS is because of the staff that we work with. So before I start this presentation, I want to take a moment just to thank each of the 2,350 members of Moorfields staff that have made the year that we've just gone through such a real success in the way that they've served our patients. And I'm absolutely sure we'll make the next year ahead of us a complete success. So from me and from the board, and I'm sure from many of you, a big thank you to the staff at Moorfields to start with. What I plan to do today is to give you a flavour really of the year that ended on the 31st of March, and then also to talk about the next 5 years, the strategy that the chairman mentioned earlier and that Rob mentioned we've had governor involvement in developing. In fact, we've had many groups, hopefully some of you in the room, supporting us in its development. So a sort of look back and a look forward. And then I'm really excited to hand you over to Peng and Maria, who I think will give you a really exciting view of the future and everything that's ahead of us. So, performance of 16-17, and we've called it highlights, and that's because I think it was an incredibly positive year. We continued to treat patients across 32 sites in the southeast of England. We treated more patients here in the UK and in the United Arab Emirates than we have ever treated. We met and achieved all the national waiting times for patients to access our services, which I think sometimes people think is kind of what you should do if you're at Moorfields, and of course it is what you should do at your Moorfields. But against a backdrop of many other organisations struggling, I think this is great credit to our clinical and non-clinical staff to have achieved all they have. And most importantly, we've continued to provide high-quality care and treatment that we can evidence as being successful both from clinical outcome measurement, but also from what our patients are telling us. Just to put Moorfields' perspective of that year in numbers, we saw 750,000 people. I recently attended an international meeting of eye hospitals, so I'm sad to say we can't describe ourselves as the biggest eye hospital in the world anymore. There was one hospital that saw 2 billion people. 2 million. 2 billion would have been impressive. 2 million in China. So I moved away from that conversation quite quickly, feeling I'm going to have to change our strapline. But certainly in Western Europe, we're the biggest provider of eye care across these sites. And when you look at figures like accident and emergency, seeing 102,000 patients a year really makes us one of the busiest A&Es in London, and therefore one of the busiest A&Es in the UK. So we are often regarded as a very much an elective service, an ambulatory service where patients generally don't stay overnight. But we should always remember we have a very critically important role as an emergency front door support to many patients. And I think as we'll come on to talk about the CQC, it was a particular area of commendation. So I would really commend all of the staff that work in our A&E and our emergency services moving forward. Very importantly, about probably our biggest ever number of patients told us what they thought of our services. Now, there's better ways we can get that feedback, but it was a really important start for us. So, waiting times are important. These are what politicians often use when they're talking about how well or otherwise the NHS is doing. They're the targets that I and the board are held to account. But forgetting all of that, what's important about them is how quickly our patients are getting access to our experts. And I'm pleased to say that within A&E, we hit the national target that 98% of patients are either treated or discharged within 4 hours. We're one of the few hospitals in the entire country to achieve that. On the cancer pathways, in terms of urgent referrals, we met the times from GP straight to seeing one of our expert ocular oncologists. We met 100% of our patients had their diagnostic tests within 6 weeks, and I'm pleased that the 18-week target, which is the period of time from which you are referred and then diagnosed and treated, we again met the target. In fact, we came within the top 3 of the UK NHS providers for meeting this target, which is no mean feat in a specialty like ophthalmology, which has quite difficult often and complex diagnostic pathways. It's very important, and the UK has made a huge step forward in reducing a hospital-acquired infection, but I'm pleased to report that here at Moorfields we continue to report no cases of C. difficile, of MRSA. You would expect that to probably be the case, given the lack of beds we have, but actually this is still a really impressive achievement, as is the fact that we've maintained very high levels for screening of VTE. Our clinical outcomes and safety records do remain excellent, and we recently received a presentation from our audit clinical lead that demonstrated again that against all the clinical outcomes we measure, we are either on par with those globally or outperforming those globally. And I think that's a really important message, and one hopefully you can take forward with great satisfaction. But the most important feedback is what our patients tell us. And I think it's critically important. We have friends and family tests. If you've been a patient recently, if you've been a carer, you would have noticed them. I think the take-up of them is okay. We need more people to feed back to us. I've been very honest with colleagues that I'm not always sure we get the right feedback, and by that I mean a completely honest reflection of people's experience, because the feedback on the whole is really, really positive, and that's wonderful to read. But we also need to know where we're getting it wrong and how we can therefore make a difference to move forward. And I know moving forward, we're looking at challenges and how we can better engage that feedback. But the comments and the complaints, the compliments are significant. And I sit at my desk kind of once a week to sit and sign off complaint letters, and they're normally in a pile about this big. And then I sign off thank yous to people who have written complimentary letters that are normally about that big. And it's a real honour to do that. But I think it's really important we don't forget the richness of what people are telling us when they feel we haven't done as well as they would expect. The joys of social media mean that you can now tweet in. I don't really do Facebook, but I can do Twitter. Compliments and concerns and worries, and that's becoming a much more of an active and useful medium for people who use that. And our staff, really the reason that we are so successful. And we ask them every year, how do they feel life is going at Moorfields? There's a national survey, there's other ways of capturing it. And I was really, really pleased again this year that compared against our peer groups, so that's acute specialist trusts like Great Ormond Street, the Royal Marsden, the Royal National Orthopaedic, our staff ranked us first for motivation at work, satisfaction with quality of work, which I think is really important, and satisfaction with the level of support they received. 95% of all staff at Moorfields would recommend it as a place to receive treatment. I saw that first figure when I joined the trust. It was around the same. It's actually gone up a little bit, and I was very concerned to think, well, what on earth are 5% people saying? But that's just the way I sometimes behave. I am reminded that that is, if not first or second in the NHS, and that many trusts, sadly, are much, much, much lower than that. But my focus is on understanding why we're not always consistently 100%. But this is a wonderful figure, and I, for one, couldn't work in an organisation where I didn't feel I'd want it to look after me or my family or friends. So it's a really pleasing feedback for us. The chairman and Rob both mentioned the CQC. It seems a long time ago now. It was 10 working days after I joined the trust, so a really useful way to get to know people very, very quickly. And I'm pleased to say that we were awarded an overall rating of good. I think that's a very fair reflection of how we perform as a hospital, with the challenges we have of 32 sites, an ageing estate, and the complex pathways connected with the care we give. But there's a couple of comments there from patients that fed back to the CQC, and when we had the Quality Summit that Rob referred to, it was incredibly uplifting to hear the type of comments that people were feeding back, particularly when inspectors use words like outstanding. And the CQC inspectors don't throw these words around. These are words that they direct because they can evidence it and because they are all comfortable that these are the right words to use. Our services for children and young people provided at the Richard Desmond Centre. The pivotal role we play in the development of eye services. So taking eye services just out of City Road, bringing them closer to people's homes in Bedford, in the east of London, in Tooting and George's. How we invest and develop our staff, which we can always do better, but we've done significantly well. Our extensive research portfolio, which you're going to hear a lot more about in a few moments. And the investment we've placed in leadership and in quality improvement. These are all significant things, and it was really pleasing to hear the Care Quality Commission refer to these areas as outstanding. But not everything's outstanding. And we are a learning organisation. And a learning organisation means you want to hear what you're not doing well, because that's how you learn to get better. And my executive colleagues and all of our staff are committed to that 100%. So we were told in no uncertain terms that reducing the clinic waiting times is something we've highlighted as a priority, and we haven't managed to significantly improve consistently. So that is our mission at the moment. We know we've got to improve our estate, and particularly highlighted us with the quality of the estate at St George's. And I'm delighted to say that I was there 2 weeks ago reviewing the new outpatient areas that have received a refurbishment and a change in layout, and they are much improved. They're still not of the standard we would completely want in a difficult building in terms of design and feel, but a really good job by our estates team to develop that area, and we're about to now focus on the inpatient facilities, but much to do. We've tried to do things to really get on top of some of the early challenges. Feedback from a number of patients I meet on my walk around say that the pager system is being used quite effectively. They enjoy picking it up. They don't enjoy it, but they find it useful to pick it up, go and grab a coffee and know when they're coming back. We've started to use check-in kiosks, and we've changed different things based on people's feedback. We've established a patient engagement group because the only people that can tell us how to improve the experience are the people who use it. And we've worked with partner organisations like the RNIB to look at how we improve communication and wayfinding, and we will continue to do that because it's critically important. Money is still incredibly important. Probably in the history of the NHS, this has been the toughest financial year that it's ever faced. So I was particularly pleased that we did well, because if you find yourself in a position of deficit and swimming the wrong way upstream, all of the things you want to do and develop become a real significant challenge. So a great credit to our staff that last year we posted a surplus of 12.8 million against the technical change for impairments, which I'm sure Stephen, our CFO, will be happy to talk to in a bit more detail. We really posted a surplus at the end of the year of £2.6 million against a plan of 2 million. So that was an impressive achievement, I think, for the challenges we faced. In terms of cash, which is very important to ensure that we can continue to be a going concern and invest and pay for things, we ended the year slightly better than we expected in terms of our cash plan. Another important line to note there is that the NHS Transformation Fund incentivised us last year to perform even better financially by matching money, if we did well, for cash to help our developments going forward. So I was delighted we were able to achieve that as well. So a good year looking back, and then a challenging year that we're in at the moment. Just looking back again, the most important figure on that slide is that almost 10% of our income grew. Some of the services, I was out at one of our network sites reporting to me something like a 30% increase in referrals in one specialty. So we know as we're all living longer, and in some cases, not in a particularly healthy way, we are becoming more susceptible to higher levels of eye disease. We only know demand is going to increase. So our job as the UK and Europe, and hopefully the world's leading eye centre, is to match this demand. We're also measured by NHS Improvement, our regulator, against a relatively sophisticated set of benchmarks to give us what's called a use of resource rating. One, they've switched it round last year just to confuse us. So 1 is very good, used to be very bad, and 4 is very bad. So it's if we didn't have such a good board, I could try and play that around and get away with things, but you can't anymore. So overall, pleasing to see that we have performed in the top category for all areas, with one exception last year, which was the use of agency. So nurses or doctors or allied health professionals or managers that we bring in on agency contracts. I'm pleased to say that in the quarter of this year that's just ended, that figure's now dropped down to 1. Because I think it's absolutely critical that we recruit and maintain our own staffing level rather than having to rely on temporary staff. We've also had a really important year in taking a role in leadership. When I joined, one of the things that we talked about a lot in Moorfields was having an international influence in eye care, which we clearly do. But I'm not sure we always have the role nationally in terms of leading an NHS services. So the Vanguard programme, led by Karen Reeves and Joe Moss in our team, has done a huge amount to drive forward a toolkit that demonstrates to the rest of the NHS how you can take a networked model of care and how you can adopt it. This is important, firstly, for us to understand how we're doing what we're doing and what we can learn better at in terms of the management of 32 sites. It's secondly good for everyone else, be it a cancer hospital or another eye service in another part of England, to learn what goes well for us and what hasn't gone well. But importantly for us, it's about us showing the rest of the NHS that we're not a specialist trust that's quite happy sitting in an ivory tower away from everyone else, that we want to take a front and centre leadership role in supporting the National Health Service. And they've done a fabulous job, supported by many colleagues, some of whom are here today in delivering this work. Research achievements, there's 3 things that we do really in simple terms at Moorfields. We serve and treat our patients, we educate people, and we lead on research. And Peng and Maria will talk a lot more about this, of course, but we supported more than 125 active projects, so that's the biggest program in the world. The Institute of Ophthalmology, our academic partner, 142 research active grants. The chairman mentioned the Biomedical Research Centre, 19 million, a huge award for an organisation of our size. Included within that an award for a further 5 years of 5.3 million for the clinical research facility. So the facility used to take wonderful science actually into people. And then finally, some of you may have seen in the news the exciting opportunities for things like the bionic eye, where I think it's 10 patients across the UK were funded to actually start to see this work led by ourselves, and I think it was the University of Manchester. Just looking at Andrew nodding, we're taking this work into direct patient care. Education is really, really important for us, and I've set out a few of the things that we're most proud, and great credit to all of our leaders, both clinically and non-clinically, and some of the achievements they've made. What that resulted in is, one, that you can help retain and develop your staff, which is critical. And as you'll see at the very bottom, we were delighted to announce in the 2007 Centre for World University Rankings that the UCL Institute of Ophthalmology was number 1 and the best place in the world to study ophthalmology. I've said to a few colleagues, I was with a professor from Harvard who came second, and I took a great pleasure in reminding him. He wanted to question the science behind the methodology, so again, I walked away quite quickly. But it was great to see us performing so well in such an important area. And what's really important about that is we wouldn't be able to achieve this in isolation. UCL and the Institute of Ophthalmology wouldn't be able to achieve it in isolation. That is where we are so powerful, when we work together. And Professor Andrew Dick and I are absolutely committed on developing this approach even more as we move forward into the future. So that's a look back. I'm just going to briefly take you to a look forward. So we launched very recently our Vision of Excellence. So this is our strategy. This is the guiding document that the board will hold me to account on, with very strict criteria and measurements on, are you achieving this, David? And I will, unfortunately for my staff, hold them to account on the same level of criteria. And this is how we make a strategy feel real and feel genuine. This was led by Joanna Moss and Andrew Dick because, again, we wanted to lead this in a collaborative way. We involved 37 stakeholder workshops at 9 different locations, and 800 people, some of you I know in this room, fed into this strategy development through online surveys and through workshops. And I was at one not a million miles from here one evening. It was really well attended with really positive thoughts and feedback from our patients. The core belief that came out of this is that people's sight matters. Why is that an important set of words? Because patients and staff were telling us it's not about eyes and eye health, it's about sight. For them, it's about sight. And it's very important we put people's sight matters front and center of what we do, so that we don't just concentrate on the eye, but we concentrate on people's sight. Working together with charities, with UCL, with many other colleagues, with patients, our aim is to discover, to develop, and deliver. And by discovery, we don't just talk about this type of science that I'm sure Peng and Maria will talk to you about this afternoon, but how do we do that? And how do we also improve the way we deliver care by new ways of running clinics? How do we develop approaches that really benefit patients? Rapid accesses to things that weren't available before. And how do we continually deliver this science and good way of thinking across all of our sites and across the world? We have 4 ambitions. We will pioneer patient-centered care with exceptional clinical outcomes and patient experience. We will be the leading edge of research, making new discoveries with our partners and patients. We will innovate by sharing our knowledge and developing tomorrow's experts, which is really, really important to build the legacy when we're all gone, and to collaborate to shape national policy. If people wish to make a policy decision about ophthalmology, I want them to be phoning me and asking me who they should speak to at Moorfields or at the Institute of Ophthalmology, because we believe we have a real opportunity to show some leadership and to support people in this challenging agenda. There are 4 enablers that help us deliver those key objectives. Attracting, retaining, and developing great people goes without saying, but it's probably the hardest time in the employment market we've ever faced to continue to maintain this challenge, both from a science perspective as well as from a medicine and clinical care perspective. Have an infrastructure that supports culture and innovation, buildings that work for innovation. How do we really get there? How do we continue to grow some of the things we've done? Continue to ensure that we are counting the pennies and staying the right side of the financial model. Really, really important for us all. And finally, by enterprising. We're hugely impressed to work with such enterprising people in this organisation who've always got great ideas. We need to support them and let them do more things to enterprise and help us develop. Finally, I just want to touch on the new site. So I think I mentioned last year that we have important plans to move from our City Road location to another site. And why are we looking to do that? Well, I've mentioned throughout this presentation the need to work more closely and more transparency with our colleagues at the UCL Institute of Ophthalmology. We believe that by both of us moving into one brand new site, into a purpose-built, highly flexible hospital that's focused on research and care, we can better define Moorfields' future for another 50 years. And I better define the way that we work with UCL and the Institute of Ophthalmology to ensure that we continue to deliver the best care to our patients going forward. I'm really pleased to say we're making really good progress in this. We're going through a governance process at the moment as a hospital. Our colleagues at UCL are going through a similar process, and we hope to be in a position over the next few months to confirm some important steps that we're making moving forward. But I just wanted to end by saying that that still remains our ambition. We're making good progress to moving towards what looks like the King's Cross St Pancras area. But I hope when I stand here this time next year, I can give you some more concrete updates on how that work is going forward. So that's really it from me in terms of giving you a look back and a look forward.